Have you ever looked at your hairbrush and wondered why there are so many strands of hair on it? We've all been there, right? It's a common concern, this phenomenon we call hairfall. But what is it exactly? And why does it happen? Hairfall, in layman's terms, is the loss of hair from the head or body. It's a part of our everyday life, but when it starts happening in excess, that's when it becomes a problem. In this video, we'll be delving into the world of hair and its anatomy, trying to understand the root causes of hairfall. We'll be exploring a variety of solutions, including some homeopathic remedies like Wisbaden, natrum muriaticum, phosphorus, and acid phosphoricum. We'll also discuss the role of vitamin E in treating hairfall. So if you've been searching for answers about hairfall, you're in the right place. Don't fret. Understanding the issue is the first step towards finding a solution. First, we need to understand what exactly is hair and how it grows. Hair, an integral part of our body, is much more complex than it appears. It's not just a strand, but an intricate structure divided into two parts: the follicle, which is beneath the skin, and the shaft, which is the part we see above our scalp. Let's dive a bit deeper. The follicle is a tiny, cave-like structure within the skin, housing the hair bulb at its base. This bulb is where the magic happens. It's where the hair's growth begins, thanks to the nourishing blood vessels that surround it, fueling the cells that produce keratin, the building block of hair. The hair shaft, the visible part of our hair, is made up of 3 layers. The outermost layer is the cuticle, which protects the hair. The middle layer is the cortex, containing the pigment that gives hair its color. The innermost layer, the medulla, isn't present in all hair types, and its function remains somewhat of a mystery. Now that we've discussed the structure, let's delve into the hair growth cycle, which is just as fascinating. This cycle consists of 3 phases: anagen, catagen, and telogen. The anagen phase is the growth phase, where cells in the hair bulb divide rapidly, creating new hair growth. This phase can last from 2 to 7 years, and the length of this phase determines the length of our hair. Next comes the catagen phase, a short transitional period that lasts about 2 weeks. During this phase, the hair follicle shrinks and the hair bulb detaches from the blood supply, marking the end of the hair's growth. The last phase is the telogen phase, also known as the resting phase. The detached hair rests in the follicle while a new hair begins to grow beneath it. After 3 to 4 months in this stage, the resting hair falls out, making way for new growth. Understanding the complex structure of our hair and its growth cycle can help us better understand the causes of hair fall. Now that we know how hair grows, let's delve into why it falls. Hair loss, or hair fall as it's commonly known, is a natural phenomenon. But when it exceeds the normal shedding rate of 50 to 100 strands a day, that's when it becomes a cause for concern. There are numerous factors that can contribute to hair fall. One of the primary culprits is hormonal changes. Hormones play a significant role in regulating the hair growth cycle. Changes in estrogen and testosterone levels, particularly during pregnancy, menopause, and even in conditions like polycystic ovary syndrome, can trigger hair fall. Stress, both physical and emotional, is another notable cause. It can disrupt the normal growth cycle, causing hairs to enter the shedding phase prematurely. This type of hair loss, known as telogen effluvium, can occur after a major physical trauma or during periods of intense emotional distress. Poor nutrition can also lead to hair fall. Our hair needs a balanced diet, rich in proteins, vitamins, and minerals to maintain its health and vitality. A deficiency in nutrients like iron, vitamin D, and protein can result in increased hair shedding. Certain medical conditions, such as thyroid disorders, scalp infections, and alopecia areata, can also cause hair to fall. In these cases, the hair loss is often accompanied by other symptoms, making it crucial to seek medical advice for a proper diagnosis and treatment. Moreover, certain treatments and medications, like chemotherapy drugs, can have hair fall as a side effect. These treatments harm the hair follicles, causing hair to fall out. With so many potential causes, it's important to identify the exact cause to find the most effective treatment. It could be as simple as modifying your diet or managing stress, or it may require medical intervention. But remember, hair fall is a common issue, and with the right approach, it can often be managed effectively. You may be wondering if there are any natural treatments for hair fall. Well, there are. Homeopathy, a system of alternative medicine, offers a range of remedies that can help in combating hair fall. Let's take a look at a few. First on our list is Wiesbaden. This remedy is particularly useful for those dealing with hair fall that causes thinning. Wiesbaden is believed to stimulate hair growth, replenishing the scalp with a fresh batch of healthy hair. It also fosters a healthy hair texture, ensuring your locks remain lustrous and strong. Next, we have Natrum muriaticum, a godsend for those struggling with hair loss due to hormonal imbalances, stress, or grief. Natrum muriaticum is a homeopathic remedy that works to balance the body systems, helping to counteract the effects of emotional and hormonal stress on the hair. Moving on, let's talk about phosphorus. This remedy is known for its ability to address hair fall resulting from itchy scalp and dandruff. Phosphorus not only helps to reduce scalp itchiness and dandruff, but it also promotes healthy hair growth by nourishing the hair follicles. Last but certainly not least, we have acid phosphoricum. This remedy is ideal for those experiencing hair fall due to general debility or prolonged illness. Acid phosphoricum works by restoring vitality to the body, which in turn promotes hair growth and reduces hair fall. While these remedies can be beneficial, it's important to remember that homeopathy operates on the principle of like cures like. This means that the same substance that could cause symptoms in a healthy person can treat similar symptoms in a sick person. It's also crucial to note that the potency and dosage of these remedies should be determined by a professional homeopath, considering individual health history and current symptoms. Remember, the effectiveness of homeopathic remedies can vary from person to person. So, while these remedies might work wonders for some, others may need a different approach to tackle their hair fall problems. Always consult with a healthcare provider or a professional homeopath to find the best treatment for you. Vitamin E is often touted as a miracle cure for hair fall, but is it really? Let's delve into the world of this remarkable nutrient to understand its role in our hair health. Vitamin E is a fat-soluble antioxidant that plays a significant role in maintaining our overall well-being. Its antioxidant properties help reduce oxidative stress in the scalp, which is one of the major causes of hair fall. By combating this stress, vitamin E helps in maintaining the integrity of the hair follicles, thereby reducing hair fall. But that's not all. Vitamin E also promotes blood circulation. You see, our hair follicles require a good amount of blood supply for their growth and sustenance. Enhanced blood circulation ensures that these follicles get their required nutrients, leading to healthier and stronger hair. Moreover, vitamin E has moisturizing properties. It helps in maintaining the oil and pH levels balance in our scalp. A balanced scalp is less prone to dryness and dandruff, which are often culprits of hair fall. It's also worth mentioning that vitamin E can potentially repair damaged hair follicles, thanks to its restorative properties. Damaged follicles are often unable to grow hair, leading to hair thinning and fall. While vitamin E can help, it's not a magic solution. It's just one piece of the puzzle. Remember, a holistic approach to hair health, including a balanced diet, regular exercise, and stress management, is key to tackling hair fall. So, we've learned quite a bit about hair fall, and potential treatments. Let's take a moment to recap the main points that we've discussed in our enlightening journey today. We started off by understanding the intricate structure of our hair, a marvel of nature that is more complex than it appears. We saw how each strand is a combination of layers, cells, and proteins, all working together to give our hair its unique characteristics. Then, we delved into the causes of hair fall, a common concern for many. We discussed how factors like stress, poor nutrition, hormonal imbalances, and even certain medications can contribute to this. Remember, knowledge is power. and understanding these triggers can help us manage and prevent hair fall. On the treatment front, we explored the role of homeopathic remedies like Wiesbaden, Natrum muriaticum, phosphorus, and acid phosphoricum. These natural solutions have been used for centuries and can be effective in addressing hair fall, given the right circumstances and consultation with a professional. Finally, we highlighted the importance of vitamin E, a powerful antioxidant that can help protect and repair our hair. It's not just about external application, but also about ensuring a diet rich in vitamin E to support healthy hair growth. So there you have it, a comprehensive look at hair fall, and potential solutions. Remember, understanding your hair and its needs is the first step towards finding the right solution for your hair fall.